We are live. So I always use the same place, Real Clear Politics, and they always have a ton of different articles. That's where I go to find my stuff. Today I found this. The CDC has failed. Ex-health officials urge states to abandon agency. What the heck? And at first I kind of thought, oh, maybe they've realized that it's not as big of a deal as everyone's making it out to be. Unpopular opinion. But of course not. That's not what happened. The Centers for Disease Control and Prevention is promoting policies that will prolong the COVID-19 pandemic, and as such, states that local leaders should disregard the agency and strike out there on their own. All this right here is a very, very twisted little misconstrued, I guess I might add. They didn't promote any of that. All they did was actually say that now you don't have to do testing on, or as much testing on, asymptomatic individuals. That's it. And from there, I guess it spiraled. And then you had a few doctors or scientists come out and say, you need to ignore it. The states and the local leaders need to do their own thing and keep testing as much as they can. Whatever. The funny thing is, I'm wondering, it didn't come out when they stated the death numbers and corrected the death numbers as far as who actually died from just COVID and who died from other comorbidities. But that whole number everyone was going around. 6% were actual COVID. 94% were all had other symptoms. Some of them even as many as 3 other underlying conditions. And it's not even that actually stumped me. It's the fact that in the list of things that are included as comorbidities, it says intentional and unintentional injury. There's actually a video you can see that'll be showed up right there that states these things and shows you where they're found from a guy that I actually follow, Tim Pool. Anyway, moving on. So I'm going to go to the doctor's note here, the doctor's note that actually stated all of this stuff, and it came from New York Times. Yes, it was an opinion piece. I get it. It has come to this: ignore the CDC. Okay. I've been ignoring them since the beginning, but that's fine. Whatever. Here we are. We were startled and dismayed last week to learn that the Centers for Disease Control and Prevention, in a perplexing series of statements, had altered its testing guidelines to reduce the testing of asymptomatic individuals for the coronavirus. These changes by the CDC will undermine efforts to end the pandemic, slow the return of normal economic, educational, and social activities, and increase the loss of lives. I can't wrap my head around this. If you're not getting outdoors or getting outside or in contact with humans, your immune system will get worse, period. End of story. That is how it works. I'm tired of hearing this crap. I'm tired of it. Take vitamin D. Take your zinc. Take your vitamin C as well. Take all the vitamins. Be healthy. I haven't stopped working since the pandemic began, and I have not felt a single symptom. Maybe I'm asymptomatic. Before the quote-unquote pandemic began, in America anyway, I was sick. I was sick for about 3 days, and it was the worst flu I've ever had, right? Turns out it might be coronavirus. I don't know, because I'm definitely not going to go get tested or get an antibody check, because that costs more money out of my pocket. Why? Understanding what need to be done requires understanding the different purposes of testing. Much of the current testing is diagnostic. Okay, fine, I get it. You guys want to know the actual rates and the actual data. You want the data. But the issue I have with that is that all the data is being misconstrued anyway. What are you guys going to do with the data? What are they going to do with the data? Are they going to make it... are they going to just put it up correctly? Or are they going to twist it some way where they can't, where it'll air to their side of things? I'm tired of it. And it was this that made you question it? Like, what about all the other crap? All the changing that's happened at CDC's website. It's constantly a back and forth, and this is here and now it's there, and I'm tired of that. And then the last straw for me was obviously the death rate. And it's pretty clear to me, and I'm not saying it's not a problem. It is a problem, but what happened to our flu season? Is it gone? And I would argue that it is, because now it's just COVID-19. People die from flu every year. A lot of people die from flu every year, actually. They also are usually elderly, and they also usually have comorbidities. But no one politicizes that. Just take your flu shot and move on with your life. I don't take my flu shot, though, because the last time I did it, I got sick, which apparently is common. It does happen. I'm not the conspiracy theorist there, but since that happened, I haven't taken my flu shot because I just stay healthy. He goes on to say, tests, however, can reduce the number of people who need to be isolated. Okay, these are practical and essential actions that need to be taken now in the absence of sensible guidance from the CDC. What can the country do to control the pandemic? We urge at least 3 actions. Here we go. State and local leaders should be... Let me start over. State and local leaders should be emboldened to act independently of the federal government and do more testing. Some governors and local public officials from both parties are already doing so and are ignoring the CDC's revisions. Second, insurance companies, city and state governments, and the Center for Medicare and Medicaid Services should recognize the economic and health benefits of testing prioritized asymptomatic populations and provide reasonable reimbursement for these tests. Ooh. If they provided reimbursement, I would definitely go get an antibody test, I guess. I just don't think it would help because I've heard of false positives and false negatives anyway. While more widespread testing for the virus is an essential factor in a pandemic control, we need to make it a part of a broad program that helps prevent transmission, mask wearing, hand washing, quarantining, and use of personal protective equipment. Nowhere here does it say take vitamins, vitamin D, zinc, help your immune system. Nothing is there. Talking about protective equipment. Vitamins are a natural source for you to get protection. That's a protective equipment. It's for your internals of your body, which is what gets sick anyway. Here we go at the end. The CDC, the federal agency that should be crushing the pandemic, is promoting policies that prolong it. They're not promoting any of this. They just said, hey, we're no longer going to do tests. That means that local, state, and organizational leaders will have to do what the federal government won't. Do you know what a promotion is? They're not pushing it anywhere. It's just on their website. This guy's a professor at Cornell Medicine and a former director of the National Institutes of Health, was a co-chair of President Barack Obama's Council of Advisors on Science and Technology, and Rajiv Shah is president of the Rockefeller Foundation. These are both of the people that wrote this or supported this and don't agree with CDC's less testing policies. Anyway, that's been a quick slice. You guys stay toasty. Toasty.